Scientific spotlight sessions at the annual meeting provide an in-depth review on a variety of topics.
Multidisciplinary tumor boards are a cornerstone of the management of patients from diagnosis to relapse and remission. Molecular genetic testing has added to the complexity of data now available to physicians, which is why this session featured a roundtable approach to a series of cases derived from clinical practice that highlight practical issues involved with the diagnosis and treatment of patients.
One of the big themes of ASH, it seems like this year, is minimal residual disease, MRD. So one of the cases we chose was NGS-based MRD of an AML patient in complete remission. And the question is, what do you do when you find molecular disease, but there's no morphologic disease? Do you treat early disease, or do you wait for the clone to progress? Sometimes it will progress and sometimes it won't. And there's a lot of nuances in terms of what those clones might be. In this case, what we found was actually a clone that was targetable by a targeted therapy. So it was a reasonable solution to try to treat with the targeted therapy. This was an IDH1 clone that we treated, and the patient remains in remission, so the story looks good.
Another topic in the spotlight, the emerging hematologic complications of illicit drug use as a result of diluting agents and adulterants. Dr. Daniel FEDERMAN discussed how levamisole, which is used in veterinary medicine, is often added to cocaine to enhance its euphoric effect. This adulterant has been shown to be present in up to 70% of cocaine samples tested worldwide. And its adverse effects include neutropenia and granulocytosis, as well as hemorrhagic bullae and skin necrosis.
So testing for levamisole per se is not widely done, so it can be hard for a clinician in a practice to actually diagnose it. But the constellation of hematologic abnormalities, a characteristic rash, and some antibody testing can help lead to the diagnosis.
And this special scientific symposium focused on cutting-edge research in hemostasis and thrombosis. For instance, Dr. David Lillicrap spoke about the critical role of two procoagulant proteins, factor VIII and von Willebrand factor, in the hemostatic process. Also during this session, the winner of the Mary Rhodes Gibson Memorial Award. The trainee with the highest scoring abstract in the field of hemostasis and thrombosis presented her award-winning research.
When patients, with advanced cancer, there's a system called the unfolded protein response, which is a way for the ER to kind of rescue itself, because patients with aggressive cancer are producing more proteins. So we're studying that aspect, and we have actually linked the unfolded protein response to cancer-associated thrombosis with patients with advanced pancreatic cancer.
The award will give her the opportunity to go back to medical school to advance her degree.